Well, good morning. I want to first thank everyone for continuing to tune into these updates. I know this remains a very difficult time with days that seem like weeks and weeks that seem like months, and everyone has been through a lot since the beginning of March. As we continue this journey, I also want to thank Vermonters for their ongoing commitment to each other, because we've got to remain united in our fight against this virus. And if we do, I truly believe we'll come through this stronger than we were before. As I said on Wednesday, this has been an important week to look carefully at our data. It's now been a few weeks from fully reopening two major sectors of our economy, and we've partially reopened others as well. Mr. Pichek will present this week's data analysis in a few minutes, but I'm very pleased to see our trends continue to move in the right direction, and we feel comfortable taking additional steps today. As I've also said repeatedly, we can't focus on our numbers alone, because the states around us are still facing a significant amount of cases. With that in mind, Commissioner Pichek will share more on the regional outlook with a very interesting time-lapsed model, which visually shows why I've been so cautious over the last few weeks and how this factors into our restart strategy. Because the fact is, how our neighbors are doing is one of the biggest factors in determining how quickly we can reopen, especially when we're talking about travel and tourism. Looking at our latest data and with the recommendations for the Department of Health, we feel it's safe to turn the spigot a bit more today. To start, ACCD will be releasing guidance that allows close contact operations and interior maintenance businesses to open June 1, with capacity limits as well as health and safety precautions in place. This will include gyms and indoor fitness centers, massage therapists, nail salons, spas, and businesses that require work in the home, like routine maintenance and home cleaning, for example. This guidance is available at accdvermont.gov. Additionally, we've increased the safe social gathering size from 10 to 25 people. To be clear, this pertains to social gatherings like cookouts or outdoor get-togethers. It does not change the 25% capacity limit set for things like retail or lodging. All of those remain in place as they are today. It's important to remember that we're able to take these steps because Vermont has been smart and safe. And we continue to see very low case numbers because Vermonters are using common sense and making good choices. This must continue if we want to open things further. And so far, you're doing just that. As most of you know, we've had a lot of questions about when we'll be able to welcome out-of-state visitors without a quarantine requirement. Admittedly, this continues to be a challenge. And again, this is why we need to focus on the regional outlook Commissioner Pichek will share momentarily. However, we are able to allow for limited overnight camp operations with a process for out-of-state campers developed with the Department of Health. This guidance will come from ACCD today as well. It's a pilot project, if you will, because taking this step within this very controlled environment will give us some insight as to how we might manage out-of-state tourists as we move towards easing travel restrictions like quarantine requirement and low occupancy limits. Again, I want to thank Vermonters for all your hard work, for being smart and staying safe, and for looking out for each other, because this has affected each and every one of us, and we're showing that together we can win this battle. So with that, I'll turn it over to Commissioner Pichek for his outlook on modeling.
Thank you very much, Governor. I'm Mike Pichek, and I've been leading the state's efforts to model the trajectory of the coronavirus here in our state. Today marks our 9th public briefing on Vermont's data and modeling outlook. As we've done in the past, I'll begin by talking about the trends that we've seen in the last week in Vermont relating to our forecasting, then talk about our restart metrics, and then last, talk about the regional data that we have continued to focus on. Again, for those watching at home, you can find today's presentation on our department's website at dfr.vermont.gov under our COVID-19 resource page. The past week, we saw our case count remain low, with only 24 confirmed cases over the past 7 days. We view this, as the governor said, as a very favorable development, considering we have been reopening our economy for the past 5 weeks, that we've seen an increase in mobility from Vermonters, and that we've also been increasing our testing capacity over the last 4 to 5 weeks as well. Specifically regarding reopening our economy, we've completed the 10 to 14-day window for 4 of our restart measures, and we have not seen any significant case growth. Similarly, as I just mentioned, during the past few weeks, we've also seen a gradual uptick in Vermonters' mobility as we continue to reopen and as the weather continues to improve. And in fact, you can actually see this week that Vermonters are now more mobile than their counterparts in New Hampshire. Generally, we've been less mobile than both New Hampshire and Maine, so this is a new and recent development. Similarly, regarding testing, we've seen a pronounced upward trend over the last 2 weeks of the number of tests that have been performed in Vermont. And at the same time, the percentage of positive new tests reported every day by the Department of Health remains steady. This is an important point, that even as we've expanded our testing to asymptomatic cases, we're not seeing a major jump in new cases. When we put this all together and turn to our forecast and our projections, we see that despite our reopening, despite the increased mobility and the increased testing, that we continue to follow our best case estimate and see a very low level case count. Again, when taken together, we view this as a very favorable outcome and trend. Turning to the reopening metrics that we've been following the last 4 or 5 weeks, and starting with syndromic surveillance, we're seeing that we continue to see an overall decline in Vermonters seeking emergency care for COVID-like symptoms since early April, and that has continued until this day. It's also well below our 4% guardrail that we've set for ourselves. Turning to our second metric, viral growth, we continue to see stability below 0.5%, with no signs of concerning growth as we reopen and as more Vermonters are getting tested. Our third data point is the percentage of new COVID-19 tests that come back positive from the Vermont Department of Health. As we pointed out earlier, this metric continues to remain below 1%, well below the 5% guardrail we set for ourselves, despite, again, increased testing. Lastly, our fourth metric is hospital and critical care bed availability. While we no longer have any COVID-19 positive patients in the Vermont ICU, we have seen a small increase in the number of admissions to the ICU for non-COVID related items. But again, we remain well below our 30% threshold, and we'll continue to watch this metric very closely. Again, when taken together, we think these 4 metrics and trends again tell a very favorable story about where Vermont is relative to its reopening plan. Last, turning to regional modeling, as the governor said and as we discussed last week, we think it's really critical that we keep a close eye on the data from our neighboring states and Quebec. Vermont is not an island, so we certainly need to be aware of what's happening around us. Plus, again, we know how important it is for both business and leisure travel that our state reopen and that part of the economy be able to function again. The current slide here shows the total number of cases between May 13th and May 20th, and then again for May 21st and May 29th for our region. First, you notice how few cases Vermont has experienced again relative to our neighbors. And then second, you also notice the marked improvement, especially in some of the hardest hit states like New York, Massachusetts, Connecticut, and Quebec, with their new case counts decreasing by about 40% week over week. On the next slide, you see a similar illustration showing the number of deaths between last week and the current week. Again, you can see that there have been some improvements regionally, but you also see a stark comparison between Vermont and our neighbors. Next, I want to turn to the drive time slide that we presented last week. We have updated the drive time map to make it dynamic, And we've also used the start time from Vermont's borders rather than from Montpelier. With these changes, the point is made even more clear that the virus and the threat of the virus remains close at hand. In fact, the drive time map tells us that approximately 41% of all confirmed COVID-19 cases in the United States are within a 5-hour drive of our borders here in Vermont. We've also created, as the governor alluded to, a dynamic regional map showing new cases by week since the start of the pandemic. This illustrates very clearly the start of the pandemic in the greater New York metropolitan area, and then how it spread to other metro areas across our region, like Boston. And then you see it spreading out into metro suburbs, and eventually spreading into more rural areas of the Northeast. The heat map also demonstrates the progress that we've made here in our state, with new cases decreasing and remaining low in recent weeks. And the same can be said for many of our neighbors, and particularly the counties across upstate New York and northern New England. Vermont's data and trends remain favorable. We continue to experience a low level case growth, and although the threat of the virus remains, particularly from certain areas in the Northeast, we are also seeing some marked improvement there too, which should all give us some signs of hope. I would again like to thank Vermonters for their many sacrifices during the challenging times that we're experiencing, and their continued commitment to put the health and strength of their communities above themselves. At this time, I would like to introduce Dr. Levine.
Thank you very much. During my comments this morning, I'll address three things: the healthcare sector, some newsworthy items of note about the virus, and some information about a small cluster. We anticipate next week we will be at what the CDC terms Phase 3 criteria for reopening, their most advanced phase. You may recall that when we were discussing the healthcare sector last week and reopening many portions of it, we mentioned that if we were at Phase 3, dentistry would be able to, again, fully reopen and utilize the so-called aerosol generating procedures associated with their profession at that time. So on June 1st, they will again be able to restart using those aerosol generating procedures with all the requirements previously detailed by me last week. There are a number of newsworthy items regarding progress in our understanding of the virus and its transmission. One has to do with facial coverings. When we talk about them, we often talk about protection from those larger respiratory droplets that people emit when they cough, sneeze, etc. It's turning out that so-called aerosols also may be important. And with aerosols, viral particles can linger in the air for a longer period of time. There's now becoming more growing consensus that facial coverings are important in protection from these aerosols, especially in the indoor environment. The next noteworthy item has to do with the concept that has been brought up at these conferences by the press actually several times regarding so-called herd or community immunity. There's growing consensus that the level of infection in a population to provide that kind of immunity is in excess of 60%. You may think that we've achieved that in many places in the world or in the country to date, but just to provide you some context, even in places that have had the highest degree of infection and significant outbreaks, the level is far below 60% for the SARS-CoV-2 virus. If we look at New York City, it's about 20%. If we look to our east at Boston, it's about 10%. If we look at Vermont in general, we believe it's well under 5%. I only say this so that people don't think that the longer the time goes on and the more they see on television about the increasing number of cases and deaths and things of that sort, that the population either here or even in worldwide where there have been significant outbreaks is close to the 60%. Meaning, we eagerly and anxiously await the development of a vaccine and of antiviral therapeutics. Final newsworthy item is role of children. I'm not going to change your world necessarily with how we think about children, but there's growing data that I thought was important to share. Because we've made a lot of assumptions about children, knowing that they become ill less of the time. They almost seemingly have a resistance to becoming ill with this virus compared to adults, or at least very symptomatic. And we know a very small proportion of them may become quite ill. There's also a lot of discussion about what role school closure plays in mitigating this virus. So there's a lot of data from both Europe and other continents like Australia that can inform us now. But again, I want to caution anyone from making premature conclusions. There's a Swiss study that shows that the pathway within family clusters may actually be more adult to child than child to adult, perhaps 80% of the time. Another study revealed that over 90% of infected children were in families where the adults were infected first. A French study found that one infected student with very close classmates did not appear to infect any of the 80 close classmate contacts. A similar study in Australia, looking at 15 different schools, came to a similar conclusion. So the conclusions of all these studies together were that schools may not be as significant a driver of these infections as previously thought, and that adults may be more likely to be the source in a family unit than the child. And then, of course, we should worry about some of the adverse impacts on our children with regards to not being in school, such as socially, developmentally, health-wise factors that we should worry about as much as we worry about needing to close the school to prevent transmission. So we'll be looking eagerly for more and more of this data as the months go on to see if it confirms and supports or refutes anything that I've told you yet this morning. And then again, finally, to put it in perspective, the rate in America of the percent of total cases at any one time is about 2 to 3% in children. It's predominantly in adults. Finally, I want to announce that their health department has been responding to a small cluster of cases in Winooski. Our staff in our epidemiology and contact tracing sections are investigating and working with many community-based organizations as well as employers to provide necessary education, to provide appropriate follow-up, and as part of our expanded testing policy, to provide more testing for those who might be identified as contacts. We're coordinating with the State Emergency Operations Center, of course, because they help us make sure that if any individual or family needs social supports as part of exercising isolation or quarantine, that they get provided that. To ensure that we are protecting individuals' privacy, I cannot offer any more details at this time, but I wanted to make sure that you were aware of the potential outbreak in the community and the fact that the health department is very much engaged and working very closely with the community and with the population in need. With that, I'll turn it back to the governor.
We'll now open it up to questions.
All right, thanks. So two questions. I guess first, might be a question for Secretary Curley. So we're kind of announcing a pilot project bringing potentially people overnight from out of state to camp. I guess, can you just give me a little more information of sort of how that will work and what that will look like, and who's eligible, and what kind of campgrounds these will be?
Yeah, these would be
Yeah.
overnight camps, summer camps. Yes, Commissioner, or Secretary Curley.
Yeah. I think I heard it. A little more detail on how that would work. Is that what you're looking for?
That's correct.
Okay. So what there's a lot of, guidelines to this. So, I'll try to summarize this the best I can, but we would welcome out-of-state campers for overnight camp. Their quarantine requirements would be they could quarantine at the camp itself if they were going to be there for 2 weeks. They could quarantine at home before they arrive, but they would be asked not to make any stops along the way, so it would have to be a drive time, guest at the camp. We also have an opportunity if they want to quarantine for 7 days at the camp, have a test, and once their test result is confirmed negative, then they would be done their quarantine. They could do the same in their home state, 7 days at home, get a negative test, and bring that result along with them. So, again, there's a lot of guidelines about asking families who are bringing the children to the camps or in terms of not making stops along the way. The handoff will look different. I think, we all imagine the family members moving the kid into camp, but there'd be a little bit of, obviously somebody's going to drop them off. We would be asking them to limit the number of people bringing them and dropping them off. So, definitely a lot of guidelines. They're all on our website, but that's how we anticipate this working.
Thank you. Then I guess second question, just shifting a little bit, Governor, yesterday you announced that you're seeking re-election, but not campaigning in a traditional sense at all. I guess then, why are you running, and will you participate in debates with other candidates?
Well, when I first started this journey running for governor, I had it in the back of my mind that I wanted to leave the office in better shape than I found it. And at this point in time, that's not possible. So I think we have to finish what we started. It comes with a great team. I can't say enough about the talented people I have around me and have on my cabinet and extended cabinet. And so as a team, I've asked a lot of them, but they've stood up and done their jobs as well. So we want to finish this. And so I think it's going to be a tough couple of years ahead as we work our way out of this pandemic and the financial situation, the economic crisis that's coming with it. But we're up for the challenge, and I think I want to see it through. As far as participating in debates, I'm saying right now I want to focus on my job, which is being governor, and this is 24/7. And until we get to a point where we can see some daylight, where we're opening up more businesses and people aren't suffering as they are today, I'll continue to do that. But when we get to a point when we can, again turn the corner, open up more businesses, get everybody back to somewhat normal, I'll participate in debates and so forth.
Stuart?
Took my question. The South Burlington School District, one of the more affluent in our state, in Chittenden County, voted again last night on a scaled-down school budget that was substantially lower than the one in town meeting did, and it failed 2-1. What does that tell you, if anything, about the barometer of hurt in our state and appetite for K-12 spending?
Yeah, I think there's a lot of uncertainty about what the future might bring. I mean, we've seen it in our state budget as well as the education fund and what this is going to mean. There's a huge hole in municipal budgets as well. So I think there's just a lot of apprehension about taking on any more expense in their own lives. So when they were faced with this today, I think that they rejected, probably a better question for them. But from the outside looking in, I just don't feel as though they can afford to do any more. So we're going to be faced with this over and over again in the next couple of years. We're going to it's going to be difficult. But again, we Vermonters are, we can face this, and we'll get through it one way or another. But we're going to take. We're going to have to be resourceful, and we're going to have to be frugal in order to work our way through this.
And you're allowing hair salons to open again. I'm wondering if you've made an appointment.
I have not. Thank you very much for asking. Again, I will prioritize that along with everything else, but I have not made any appointments.
I thought Mr. Scott might have made the appointment.
She might want to, but I'll make my own. Thank you.
Governor, I guess I'll ask another political question, but I mean, your opponents are probably going to say, well, you're sticking your head in the sand or you're using this as a shield. How would you react to that? I guess?
Well, I stand up here 6 hours a week answering questions, so I wouldn't say I'm sticking my head in the sand on anything. I've never bowed to a challenge of any sort, but this has to take priority. It just doesn't sit well with me to think about campaigning and raising money and doing all these things when people in Vermont are suffering, and we can help with that if we really pay attention. So it's going to take all of my attention, the attention of my entire cabinet, to make sure that we get through this and we get through it safely. So that's why I want to prioritize that. And if I, suffer politically for that, that I'll accept that.
And I guess, Doctor, I just very quickly in the Winooski, to clear up the Winooski thing, is that limited to a specific, say, a group home or something like that situation, or is it more spread out than that?
So if I can rephrase your question just so I answer it correctly.
Sure.
Is it in a facility versus a
Right.
community? It's in the community, not in the facility.
It is, okay. Thank you.
All right, we'll move to the phones, starting with Chris Roy from the Newport Daily Express.
Yes, good morning, Governor. I'm wondering if there's any data available to show how much money the state lost during the shutdown, for example, from tax revenue, and how can the state make that up?
Well, I mean, we're gathering that every day. We can see, we rely on the business community. We rely on individual income, corporate taxes, rooms and meals, sales taxes, and so forth for our budgetary needs. And without businesses being open, we're going to take a hit in that area. So we gather that again on a weekly, monthly basis, and we're seeing that a gap does exist. We'll see more as we move through. We'll get through this fiscal year okay, because we're in a pretty strong position before we started. We actually would have had excess revenue in the end, which would have been nice to see. But because of the strong financial position we were in, the reserves we have, we'll get through this fiscal year. It'll be next fiscal year. It's going to be the real difficult challenge that we have to comprehend. We have to, again, face. And we'll see what happens on the federal level and what they're going to do. I would expect that there will be some. I know the House of Representatives passed a bill that would have helped fill some of our budgetary gaps, but it doesn't appear that it's going to be taken up by the Senate at this point. But I wouldn't be surprised if there's something more that could help alleviate some of the pain in the future. So again, we're going to work our way through this. We'll accept whatever comes our way, but at the same time, we'll get through it one way or another, and we'll do it together.
Is there a possibility that you might ask the legislature to add more new taxes or an additional sales tax or anything like that?
Too soon to tell, Chris, really. New taxes or tax increases are the last resort as far as I'm concerned. Again, we're seeing Vermonters suffer individually, collectively, and I think the last thing they need is more expense at this point. So we're going to again contemplate that as the next few months move along. A lot of it will depend on what they do on the federal side, and that will determine what we have to do from there.
Okay, great, thank you.
Cliff Cooper, North Avenue News.
Good morning. Hey, with the opening of the groups of 25, will this be a go-ahead for kids' sports like Little League and softball teams if they are going to do the COVID protections of 6 feet and distancing and only 2 people in the dugout and that sort of thing, and disinfecting all their equipment? Would this be something that would be open very soon?
Yeah, we're contemplating that. We certainly would like to see some of these organized youth sports continue in some capacity. At this point in time, it doesn't allow for that, but it does allow for them to get together, throw the ball around, develop skills and so forth. So we're moving towards trying to do something to open up that sector as well for some of the organized sports.
Is there any timeline on that?
As soon as possible. Again, watching the modeling, doing what we can, developing policies, procedures, and so forth. We want to do this. We want to alleviate some of the pent-up frustration that's out there, but we want kids to have something to do. And so this is high on our priority list.
Okay, thank you, Governor.
Sean Cunningham, Chester Telegraph.
As a real-time snapshot of the situation right now, is it possible to get a town-by-town map that would only show active cases rather than the cumulative number?
I will let Commissioner Levine answer that first.
The answer is I'm not 100% sure. I can take that back to my data team, my health surveillance team, and ask that. As you know, just by Commissioner Pichak's presentation, the number of active cases is very small at any one point in time, so it would really be hard to draw major conclusions from it. But I can certainly take that back, and we can get back to you after that.
Thank you.
Greg, the County Courier.
Hi, Governor. I think this is a question for Dr. Levine. We had a reader reach out to us who's a doctor, has been working through this crisis. How many of the new cases or the cases in Vermont can be attributed to it being picked up in Vermont, or I guess also how many of the cases can be attributed to out-of-state contact?
So I'm not going to give you a number with precision, but for a long time now in Vermont and across the country, we are always talking about sustained community transmission, meaning the virus is among us, every state, most communities. So early on in the pandemic, there was a clear correlation between being exposed to a COVID-19 positive person, and inevitably that person happened to have been in another country quite often and come back to the United States. For a long time now, the virus is among us in the United States, and community transmission is what it's all about. We do, on our daily set of cases that we report, know if there is a case that's present in somebody who has a primary residence out of state. I would have to say, though, that the majority of cases are Vermont cases, and when we do contact tracing, sometimes they may involve borders because a lot of our communities live on borders, but the contact tracing predominantly involves the people close to that individual in their current living environment. So that's probably the best I can answer your question right now.
Okay, and little bit of a side question, but also a follow-up on that. Over time, we've heard that these numbers, if, say, somebody has a primary residence in St. Albans, Vermont, but is, and they pick the disease, the virus up in Florida, test positive in Florida, that Florida would know and it would show up as a St. Albans case. How many of our Vermont cases are generated from out of state with that person not even stepping foot in Vermont?
Yeah, so again, I won't give you a precise number. I had to memorize a lot of things to get through medical school, but some things are less important to memorize. But the bottom line is very few would be the answer I would give you. We do get reports from other states, no question, but if you look at our total, which is now in the upper 900s, I would say it's a very small percentage of those that are being reported to us by other states.
So can we those numbers, and can we get the numbers on people that are that contact tracing has shown have gotten it from out of staters?
Certainly, I can look into that for you.
That'd be appreciated. Thank you.
If I could just, this is always dangerous. Can I elaborate just a little bit? Greg, if you haven't seen the heat map, you should, because it's fascinating. And I don't know if Commissioner Pichek, whether that's on the ACCD site or on your site. So the Department of Financial Regulation, take a look, because, in reality, none of the cases started in Vermont. None of them started in New York. None of them started in Boston. None of them started in Florida. One of the first cases that I ran across came and that started to venture into Vermont came out of New Hampshire, but it was as a result of someone skiing in Italy. So none of this started here, but it migrates. And when you see the heat map, and you see it's like a Doppler, and when you see what's happening, that it started in the Northeast, mostly in the New York City area, and then it migrated from there into Boston. They didn't ask for it, and then it went into New Jersey and Connecticut, and Rhode Island, and then into New Hampshire, and then it's starting to migrate north, and that's why it gave me pause when I started to see these numbers and see what was happening. So study the Doppler, the heat map, and then you can see how this moves around. So we can't insulate ourselves. We can't shut off our borders, but this is how it happens. So as you watch this wave, as you watch this continue to dissipate, you can see why we're starting to open up in other ways. So we'll get through this, but it's taking a little bit of time. But it's there's some good news there when you watch the map and how it moves and the time it does.
Certainly, Governor, and I think the doctor that reached out to us, really just kind of wanted to get an idea as to, how much this was a community spread at this point in time, not, 8 weeks ago. But certainly your point is noted.
Yeah. Thank you, Greg.
Peter, VPR.
Two quick campaign questions, and then a question for Commissioner Pichek. Governor, will you commit right now to participating in a primary debate with your Republican challengers?
Yeah. Again, Peter, I'm concentrating on the job ahead of me as governor. But if we continue to move in the direction that I'm pretty certain that we're going to be, and continue to see the numbers that we're seeing without having an about face, then I can see myself, participating in debates before the primary. Yes, but it all, it's all predicated on what happens here with this, with the coronavirus.
You also said you won't be doing any fundraising. Will you be accepting donations to your campaign?
Yeah, I'm not actively pursuing any contributions at all. But if they come through the door, obviously I won't be turning them back. But I'm not actively campaigning. I'm not actively fundraising. I'm really focusing at the job at hand today.
Thank you, Governor. Commissioner Pichak, I was looking at the slides, and it looks like the doubling rate has gone from 46 weeks during the last presentation to 28 weeks now. I'm wondering how we reconcile that figure with you were telling us that everything looks steady as she goes in terms of the trends.
So thanks for that question, Peter. What I would really look at is the new case count. Like I mentioned, we had 24 cases this week, 20 last week. So it does give you a sense, though, and thanks for pointing that out, it does give you a sense of how sensitive some of these numbers are. I would put the doubling rate in the same bucket as the RT, or the transmission rate. Those are very sensitive because we have a very low case count. But even though we have 28-week doubling rate, I would also point out we continue to be third in the nation on that metric. So we still are standing out on that metric. You can see again how sensitive it is to just 4 additional cases this week than we had last week. But again, when you take all of that information together, it tells a very favorable story considering, again, the reopening, the increased testing, and the increased mobility of Vermonters.
Thank you.
Ann Wallace-Allen, VT Digger.
Hi, can you guys hear me?
We can.
Great. So, Governor, you mentioned that this process for out-of-state campers is going to serve as a pilot project of sorts within this very controlled environment that might give you some insight into how you would manage out-of-state tourists. Is there any more information you can give me about that, or the possible timing of that? For example, if people are coming to the camps and there's no sign of increased infection, if they follow the instructions, what might happen next?
Yeah, I think this, as we watch what happens with this and what we're contemplating, it just will inform us as to what we might be able to do in the future. We talked about this quite a bit in one of the meetings I had, one of the many meetings I already had this morning, and about how do we get to a point where we can accept more people into the state, more tourists, because, it's part of our economy, and we want to get there as quick as possible, but we want to do that safely. So we thought this could inform us. We're also contemplating other measures which might get us there as well, but too soon for us to give any details, but we're actively pursuing this.
So, great. Do you think that it might lead to sort of an opening up by July 1st of some sort?
It's really hard to say, and again, so much of it depends on this modeling, and when you really study this heat map, I think you can see what we're facing and the opportunities in the future. Because if you look back just a week or two, you can see that the case counts are starting to drop in other states, particularly New York. That's good news, but there still is a lot of cases as well. I mean, there's thousands of cases in New York right now. The death rate is still too high. So we just have to pay attention and to move in a deliberate fashion and do it meticulously in a measured way. And that's what we've been doing thus far, and it's served us well. And we'll continue to do that to keep Vermonters safe. But at the same time, understanding we want to open up just as quick as we safely possibly can.
Thank you so much.
Avery, WCAS.
My question is for Commissioner Levine. Is there any more information you can give us on this when you see, I don't want to call it an outbreak, but a cluster, whether how many people there were, are they in the same family, and how did you all learn about it?
Yeah, unfortunately, I can't give you a lot of specifics regarding the cluster of cases that we're involved in, but obviously the way we learn about it is through a positive test result, and that triggers the entire so-called box-it-in strategy: testing, isolating, contact tracing, quarantining as appropriate. So that's the way things began, and that's about all I can say at this point in time.
Just a quick follow-up. Should the community be concerned, or is it something that's under control?
It's very early in the game, but I think we have a great idea of where the cluster is, through the contact tracing, who to be educating, who to be recommending quarantine for. So I'd like to give you the impression that we really have made a good assessment of the situation, and that people should feel confidence in that.
Anything else, Avery?
Nope, thanks.
Tim, Vermont Business Magazine.
Governor, just following up on some other questions about out-of-state visitors. Peter Welch got an earful a couple of days ago about from the lodging industry, and one of the comments was we can't do curbside lodging. And it sounds like the lodging industry would be willing to do just about anything to get people here, including, quarantining at their facilities, testing, anything it would take. How do you respond specifically to the lodging industry, using the camping as a test case that would push this down the road, obviously, some weeks. So what's your response specifically to the lodging industry on that?
Yeah, well, again, if we continue to see the numbers we're seeing, we're not just waiting for the results of the campers. We're just trying to figure out, contemplate whether there's a path forward for us to open up lodging more and accept more out-of-state visitors. I mean, we know this is somewhat the lifeblood of Vermont, and we want to do this as quick as we possibly can. But we have to do it safely. We can't lose ground on all the ground we've gained. We've been, Vermonters have stepped up, and they've done a great job in protecting ourselves. And we'll benefit from that in the long run. We already are benefiting from that. But we don't want to lose ground either. We don't want to make a mistake. We don't want to, go back about 3 steps and have to put measures in place that are further restrictive. We just want to keep moving forward. So we'll do this in a methodical way. And again, this is a priority for us, but we're working on it, and we hope to do it again just as quick as we possibly can.
I know you've been reluctant to give false hope in all these issues. You've suggested in the past that there could be some in-state quarantining in some regard along those lines. And it also sounds like in these comments today that you wouldn't necessarily wait for the evidence from the overnight camps. Do I understand that correctly?
Yeah, that's right. I mean, again, we're putting the plan together. We'll see how that works. And it'll inform us as to how we put the plan together for others. But we won't wait for the complete results of that. What it will do is inform us as to the strategy that we're using, whether it's we can implement or not. And we've got other ideas as well as to how we can do this. So we're on this. Again, as we open up more sectors of our economy, this is a priority for us.
All right, great. Thank you very much.
Aaron, BT Digger.
Hello. With the out-of-state modeling, how are you tracking how people are moving in and out of Vermont? Are you using cell phone data? Are you analyzing the traffic data? And do you have any possible intentions to include an analysis of that in the modeling update?
Well, again, I think on Wednesday, I was talking about some of the traffic data from over the weekend, and we, some had been concerned and had thought that we were being overwhelmed with folks from other states coming in. And what we found was with the traffic data that there were 10,000 more vehicles coming into the state on Friday than there had been the week before, and maybe a few less leaving. So that informed us in some respects. We're not using any other means to determine that. Again, the control in some respects that we have right now is the limited number of lodging facilities that are open to only 25%. And again, we'll continue to monitor with the heat map that we have and determine when we can open up the borders more and open up lodging more.
Okay. And the second question was, do you have any plans on kind of releasing that to reporters in the public on a regular basis rather than, one-off mentioning it at a press conference?
You mean as far as the traffic counts?
Yeah. Whether that's in a modeling update, in a regular map or
Yeah.
data release, or the weekly releases that you put out.
Yeah, let me look into that,
Anything like
Aaron.
that?
Yeah, I see no reason why not. Let me look into that.
Okay, thank you.
Brittany, Local 22.
Hi. So just a quick question about the openings that you announced today. I know you said guidelines will be coming out later today, but I was just wondering if you could touch on any of the guidelines, maybe at a 25% capacity, just the different guidelines that we're going to have to follow.
Yeah, there are specific guidelines for safety and so forth. Secretary Curley, could you give some examples?
Yes, if we're specifically talking about the overnight summer camps and the limited residential summer college programming, we have a 75% bed capacity there. But there are a few other things that were changed as well today, or opened as well today, like our stage 2 closed contact business. You also, 25% of approved fire safety occupancy. So again, it's not like full wide open, but there's definitely some guidelines. Again, they're all outlined on our website. And for folks who are looking to get into their first phase of the reopening starting June 1st, make sure you go to our website and look at the restart, because it's going to be important that you not only meet the occupancy limits, but that you also follow the required health and safety guidelines.
Secretary Curley, is that up on your website at this point in time?
If it's not up right now, it will be up before the
I'm hearing, I'm hearing that it is up from some of the folks in the audience. So yes.
Yeah. Okay.
Perfect. Thank you so much. Really appreciate it.
Wilson, AP.
Hi, Governor. I'm curious. This question might be a little early, but I'll ask it anyway. It seems the current state of emergency is extended through, what is it, June 15th, right?
Right.
Do you anticipate extending that again? And then how long do you feel that would be needed? And without a state of emergency, can you impose or make any of these requirements that we've been talking about now for so long?
Yeah, that is a difficult question because we have to unwind this in some way, and that's why we're using the state of emergency to do so. So I would anticipate we might have to extend again, but my goal is that we not have to continue with a state of emergency for any long period of time. We want to get this over with, and then we may have to engage with the legislature to put different provisions in place to allow for us to, again, continue to unwind. But we're not there yet. But we're getting closer, obviously. When we can get to a point where everything is open at 25%, then we can contemplate opening up a little bit further. Maybe it's, the entire economy could open up from 25 to 50, let's say. And that's the goal, is to get everybody on the same playing field and then be able to open it up from there. But it's hard to say at this point how long that's going to be. But from my standpoint, the quicker the better.
Okay, sure. Thank you. And just a quick follow-up for Dr. Levine. I'm going to try another one on the Winooski situation. Winooski, as you know, is known for its immigrant or new American community. And in other places, it seems like those communities have been hit especially hard by COVID-19. Is that, can you say if that's what's going on here in Winooski now? And that would be my last question.
Yeah, thank you for that question. The fact of the matter is, whenever we have released data about cases, even on a day-to-day basis, we are providing information regarding their age, their gender, if they were hospitalized or not. And we've really stuck to that important formula. So we will be sticking to that formula again as we talk about this cluster right now. So I really can't give you the answer you need. I can tell you, you are correct that there have been some populations nationwide that have been more severely impacted by COVID-19 than others. And it's important to know if that would be happening here in Vermont as well as anywhere else. But the fact of the matter is, everyone is susceptible to this novel virus that was never seen by the human race before. And the enemy is not the individual who's getting the virus. The enemy is the virus. And certainly in our health department and in our state, we really do stand on the principle of health equity and really reducing disparities and reducing inequities across populations, making sure that all have a chance to be equally healthy. So we're clearly looking at this cluster like we would any other and making sure that there are no factors that may have played in that would have been related to issues regarding their susceptibility to the virus or issues regarding discrimination or bias or anything of that sort. But that's all I can tell you at this time.
Okay, thank you.
Mike Donahue, the Islander.
I guess I'd like to follow up on Wilson's question there, Commissioner, and trying to find out a little bit more about the Winooski situation. I know you're claiming privacy, that you can't say more, but obviously one of the criticisms we've heard loudly is that you seem to pick and choose when you claim privacy. You claimed HIPAA there at one point. That was proven not to be, is not relevant when you're talking about statistics. The Bennington case with the students at the school. I mean, there's only 40 students down there, but you talked about that case. So I guess trying to get a better handle as to, you know, you seem to pick and choose, but why can't you say more about this? And especially as Wilson pointed out, it's a diverse community over there. So if one segment of the community has a higher level, why not identify that one?
So, thanks for the question. I would argue a little bit about picking and choosing. I think we have principles that we stand on, and as I pointed out to Wilson, you know, we've been very consistent when we talk about individual data about what factors we identify and what not, and we actually do stand on HIPAA for that, and we also stand on Vermont state law with regarding the amount of information we can provide. We've been very transparent.
And I've asked for the specific laws, and nobody's been able to point those out. So
I'll be sure that our communications office sends you the VSA appropriate finding. The fact of the matter is, with facilities, you know, we're generally identifying a facility with a bunch of people in it. And the commonality of the people is that they are in that facility, but there isn't a lot of individual data that we're providing about each and every one of them. This is very different when we're talking about a cluster within a community. And as I said, we do stand on the principles I mentioned, as well as the principle of health equity. You're right to point out that this community is better known than many communities in Vermont for having a large degree of diversity, cultural diversity, racial diversity, etc. And I think we all understand and should respect the fact that part of the reason that these diverse populations are in our country now, never mind in our town in Vermont, are because of some of the trauma that they experienced in the country of origin. And we certainly do not want to make any kind of a presentation that would further rekindle trauma in a population that's already experienced it. Thank you.
And one follow-up one follow-up with the governor. Yesterday, while talking with Secretary Mike Smith, I was parked at a convenience store, and out of 26 customers going inside, 20 were without masks. And I'm guessing that the lack of people wearing masks has to remain a big frustration for you during this time. And as you look back over this COVID experience, can you give us maybe 2 other frustrations that you've experienced in fighting the pandemic and not being able to get people to come around on it?
Well, I say for the most part, I think Vermonters have stood up and done what they were asked to do, and our numbers show that's happened, and we're reaping the benefits of that as we speak. So while it may be frustrating to see people who aren't taking precautions and not wearing a mask, because I think it is a good idea when you're out, at the same time, you can't argue with the data. When you look at the low number of cases, and we've opened up retail, we've opened up some major sectors of our economy, and our numbers are still low. So obviously, whatever we're doing is working. So we need to keep it up. And if we could, I would ask for Vermonters to wear a mask when they can. Some people can't for different reasons. We have to respect that. But at the same time, it's altruistic. It's about helping others, preventing others from being infected. So if you could, I'd appreciate it, but I understand that some people can't. In terms of other frustrations, I mean, it's like a daily occurrence of frustrations. I mean, this whole pandemic is frustrating because we were on the right track in terms of our economy. We've done a lot over the last 3 or 4 years, and we really turned the corner and had surpluses at the end of the year. To see that all evaporate in one period, in a 3-month period, is frustrating. It's frustrating for me to watch the people in line waiting for food distribution. That's frustrating and concerning to me. Seeing people, 50 to 100,000 people reaching out for unemployment benefits, that's concerning and frustrating for me. So every day I go through something that's frustrating and concerning, and but there is hope, and I believe that we're doing the right thing and that we're turning the corner, and better days are ahead. So while it's it's been difficult for many, and I see it on their faces. I see it in some of their remarks. For the most part, we're better off than some other parts of the country, and we should be proud of what we've done.
Thank you very much.
All right, Kat, WCAX.
So we've seen each Friday for many weeks now good data, really good data about what's happening in Vermont. And you showed us data today that says even with our reopening steps, we are not seeing significant case growth. And I know you just said how frustrated you are by the ongoing pandemic, and you've repeatedly said that you want to reopen Vermont as soon as the data says it's okay. So my question is, where is the data that says we can't reopen our Vermont businesses faster, but keep restrictions in place on out-of-state travel until our neighbors look better?
Well, that's somewhat what we're doing. We rely heavily on out-of-state visitors to drive our economy. I think we've proven that. I think you would, if you ask some of the the folks in lodging, hospitality, in the restaurants, and so forth, a lot of their business is due to out-of-state travel and out-of-country travel. So restricting that has been difficult for them, and I'm just not sure how we have both at this point in time. As you saw with the heat map that we provided earlier, there's still a lot of cases just to the south of us, a lot of deaths on an ongoing basis, just this week and last week. But it's getting better, and we're seeing this start to migrate away from us. And as soon as we can do that, we see that continuing. We want to see more out-of-state visitors coming here to Vermont to take advantage of all we have to offer. But at this point in time, it's just not safe to do so. So Again, the strategy that we've been using appears to be working, and I know it's frustrating for some, but if you look at the bigger picture, and we have to look at the regional picture, you can see that that one false step, opening up too quick, and we'll set ourselves back a month, and that's something that I can't stand by and watch.
So maybe I should clarify my question a little bit then. Let's take the tourism businesses that are directly focused on out-of-state travelers out of this equation for the moment. You've got retail in Vermont, you have personal care industries in Vermont that are opening at a limited capacity at this point. Earlier you just said if we can get everyone opening at 25%, then we're going to go 50%. Should we be considering a more targeted approach to get other businesses open at a greater capacity sooner if they do not rely on out-of-state visitors who might be at risk of bringing a virus in when our rate in Vermont right now is very, very low?
Well, again, if we can get all on the same field and at the 25% level and then start expanding from there, I think it'll make a lot more sense to people. There'll be more certainty, and they'll see some hope and some light at the end of the tunnel. So it's just a strategy that we've decided to move towards. Again, it seems to be working, so we're going to continue to do this in the same fashion.
So the strategy is everybody at once?
Well, we're getting everyone, we're trying to get everybody open at this point. We still have a little ways to go. I mean, most sectors are open on a limited basis, but the next step is in interior dining, inside dining in the restaurants. That's the next major step that we want to take. So again, we have to see the ripple effect. Are we doing any damage? Is our case counts climbing? Are our death rates climbing? What's happening? So if we do this in a measured way, we'll be able to reflect on that and make sure that we're not doing any potential harm to people as a result of our actions.
Okay.
Thank you.
Joe, Barton Chronicle.
Hello, Governor. I guess I'm taking another whack at the question about allowing people from outside of the state to come in larger numbers. And I know that in setting standards for reopening Vermont businesses, there were, as Commissioner Pichek outlined, several very distinct standards. And I'm wondering, are there standards that he or you could articulate that you're looking at before you decide to open the door to the state a little wider?
Yeah, there are standards we're looking at. I'm going to let Commissioner Pichek answer that.
So thank you for the question. I think, we need to look obviously at, what is going on around us in terms of new case growth, but I think probably the most important metric is active cases. That tells us what the threat is currently. And then, of course, different regions are going to have very different populations, so we have to try to figure out what that means on a per capita basis. Obviously, by using those two metrics, per capita and active, it gives us a sense of what the relative threat is. If you look at either the drive time map or the heat map, you see that certainly in the Connecticut, Rhode Island, Boston, and New York metro area, both of those numbers are significantly higher than they are in the northern, New Hampshire or Maine or northern New York areas, for example. So I think those are good measurements for us, and those are measurements we used when we were coming down our curve, if you will, in April. We talked frequently about when are we over our new case, peak, when are we over our new active case peak. So I think that's an effective measurement, and that's one that we're actively monitoring.
Are there any numbers that a layperson, reading them in a newspaper, for example, might be able to look at and see that we're approaching the time when it might be possible for businesses to welcome patrons from out of state?
Yeah, it's another great question. We're working on that exact item, both in terms of how do we visualize it for ease of understanding and communication, and how do we articulate it in the same way. So I think in the near future, you'll see more on that. Again, generally, if you just visually look at that driving distance map, it gives you the active case count, and you can get a sense visually of where are there concerns and where aren't there concerns, just based on, where are the cluster of active cases.
That, just to be clear, when the state is ready to invite people back, you don't really have the option of saying welcome from Massachusetts but not from New York.
Well, I think certainly, when you're talking about, do we have the legal authority under the emergency declaration, I think as long as there's a legitimate health reason for doing so, I think there's flexibility there. So I think it all depends on where is the health crisis at the current moment. Is there a rationale for it and a legitimate rationale? And certainly if Massachusetts or New Hampshire or Maine are looking considerably better than each other, then I think there is room for discretion there.
Thank you very much.
Joe, I think the bottom line is when they start looking more like Vermont, that's when we'll be feeling more comfortable to open it up to out-of-state visitors.
All right, Tiffany, Bennington Banner.
Because of ongoing factors like social isolation and job losses during the pandemic, how concerned are you that Vermont will see a significant rise in the use of illegal drugs, particularly opioids, as well as alcoholism? There's already been preliminary data that there's been an increase in the pandemic started.
I know we've had some good news in terms of opioids in the state, which is welcoming. But we look at all the data. I'm obviously concerned about the isolation and what this means, and that's why we're trying to open up just as quick as we possibly can to get back to some sort of normalcy and get people back to work. But that is a concern. Dr. Levine.
Yeah, you very appropriately have linked social isolation and some of the ills in society, whether they be increases in mental health risks, whether they be substance misuse, what have you. That's been a concern all along. It's a national concern, not just a Vermont concern. And similar to what the governor was saying about having had surpluses and now look at the condition the economy's in, we look at substance misuse and other of these factors the same way. Progress was definitely being made in many of these areas, and we hate to see it erode. So the fact of the matter is the most stringent application of mitigation strategies was stay home, and stay home has now been relaxed. So that is a very isolating kind of strategy, but obviously it was incredibly successful in our dealing with a pandemic. And now as we relax it, we're still having success, which is good. So we would hope that at least if that one factor, social isolation, would be playing a significant role in people's use of or misuse of medications in general, that there will be less reason to do that now than there was during the time, which didn't last all that many weeks when you come down to it, of having people really stay home as much as possible. So I would like to look at it in a more glass half full than half empty way at this point in time, because I see us all coming out of this and we're all kind of engaging again. We're enjoying nicer weather. We're being outside. We no longer feel that we have to be at home as much of the time as we may have had to previously. Does that answer your question well enough?
Yes, thank you. And just to follow up, how about the rate of suicide?
Yeah, we just discussed that actually this morning on a call across the Agency of Human Services. And, there is a problem in Vermont, and the problem is we are small. So looking for statistically significant differences from 1 month to another month, 1 year to another year, it's just as Commissioner Pichak was talking about some of the data this morning. When you go from 20 cases to 24 cases, or as I talked about regarding CNN's reporting, when we went from 4 cases to 7 cases, and that was regarded as a greater than 50% increase in our caseload, and we were going the wrong way in Vermont. Very challenging to look at data like that. When we look at our suicide data over 4 years and try to compare 1 month in 1 year to a month in another year, overall we have not seen a significant uptick in that information. So we're kind of reassured by that. But there are, again, month by month fluctuations in data that we have to just not look at from a standpoint of being super concerning at times when statistically they aren't really outside of what you might expect with variation.
Thank you.
I just, again, want to add one area that we didn't talk about that is an area of concern for us is the elderly population, particularly those who are still in our long-term care facilities that are feeling isolated and depressed. And we need to make sure that we have a plan where we can get them back out, so to speak, so that they can see some of their family members. So that's something that we're working on as well.
All right, just to switch up the order of 2 callers because Dan D'Ambrosio from the Burlington Free Press needs to jump off the line. So go ahead, Dan, and then we'll go back to Steve.
Thanks a lot. Hi, Governor Scott. You mentioned indoor dining. Do you have any idea at this point when that might happen?
Yeah, I'm really hopeful that we'll be able to make some sort of further announcement on that next week. At least give some sort of time frame because that's again an area that that's going to be the next sector that we want to open. So I'm hopeful if the numbers continue to move in the right direction that we'll be able to have that conversation next week.
Okay. Now I have 2 quick clarifying questions. Does the overnight camping, relaxing that, does that include summer camps as well as campgrounds?
No, that is summer camps that we're talking about today.
Oh, okay. Okay. So campgrounds are still closed, right?
No, campgrounds are open to 25% capacity.
Okay. And the increase of 10 to 25 for social gatherings, is that indoors and outdoors?
I don't have the answer to that. We encourage outdoor, but
Yeah.
Secretary Curley, do you have any information on that?
Yes, that does include indoor as well. But again, we're asking, so we prefer the outdoors. If it's going to be indoors, we hope that there is lots of precautions taken in terms of people staying, a bit apart from each other,
You need a
protecting
big
themselves,
house.
wearing masks. But also, just because I have a moment, I want to clarify because I think there's a lot of confusion happening out there about the announcement about the overnight kids summer camps, and I think the governor just tried to clear it up. But just to be really, really clear, because we're getting a lot of feedback on this, our change in quarantine is only for children's overnight summer camps at this point. It is not for regular campgrounds. And I think in our minds we were clear, but I'm noticing on social media it's not clear. So just wanted to take that opportunity.
Okay, so the change is only for overnight, for children, overnight summer camps, not for regular campgrounds.
Correct. And the reason for that is that we are able, those campers are contained and they're, under the coordination of an organization, and it enables us to really understand where they have been and who they have been with should there be an outbreak. So
if people are coming from out of state, you mentioned that people can come from out of state, I think. They would be going to these summer camps, not to campgrounds.
Correct.
Okay.
Correct.
Okay. Thank you very much.
Thank you. Thank you.
All right, now we'll go back to Steve, NEKTV.
Can you hear me?
We can.
Okay, thanks. A couple for the doctor and one for the governor. The governor Dr. Levine, the governor just mentioned a skier who brought this back from Italy. It seems to be that there's anecdotal evidence that this virus came ripping through in January, February, and March, and we're at the very tail end of it now. And given the preponderance of the recent testing showing not very many active cases, wouldn't we be better off or get a better picture through antibody testing? Isn't this something that we could, have labs, local labs that our local hospitals do?
Yeah, thanks for that question. Let's start from the beginning of your question where Italy came up. We are talking about a pandemic. And in 2020, 2019, 2020, obviously, diseases can spread so much more quickly. All it takes is one plane flight from one part of the world to another part of the world. So we can point fingers at people who chose to vacation in Spain or Italy or wherever and say they brought the virus to us. But the fact is, this is what happens in a pandemic. It begins somewhere, and it begins to spread outward from that place. Again, we can make ourselves the enemy as humans, or we can make the virus the enemy, and I prefer that the virus be the enemy. Once the virus is brought into an area, it is then capable of infecting people who happen to just live in that area. So without too much time going by, you begin to document what we call community transmission. And that's what we're seeing in this country right now, because obviously we have so many travel restrictions in place from other parts of the world that the virus that's here is here. And then now we're using the kinds of strategies we've used in Vermont to try to suppress it. So at its level of suppression now, the role of antibody testing. And I want to preface this comment by the fact that the work group that I've assigned to the task just met again 2 days ago, and they are submitting a more formal report to me. But just to give you a sense of where the field is right now, there are now, we believe, some more reliable and valid antibody tests to do. When I last spoke about that was really not certain, but the FDA has now actually pointed out several tests that seem to have the requisite reliability that we would use them and the validity. The fact is, most people who write about these tests are not enthusiastic about their use for individual use. And individual use means I can go back to work now because you showed that I have antibody to this virus, so I must be safe and nobody can suffer if they've been in contact with me. And that is not their use at this point in time. Their use at best is to figure out how prevalent the virus may have been at a point in time in the location you're testing. So if you're testing a state and you do a random sampling of people in the state, you may be able to figure out where you are from my comments earlier about, Boston 10%, New York 20%, Vermont probably under 5%. So just like with our current testing of PCR with the nose and secretions to find active disease, I suspect if and when we do serology testing to look for antibodies, we will also have a predominance of negative tests because we just don't believe there have been that high a percentage of Vermonters exposed to this virus. So that's sort of a glimpse at the future, and I'll be giving a more formal assessment when I get the full report from our working group as it concerns our state.
Okay, and regarding the numbers from Massachusetts, aren't the numbers from Massachusetts like over 50% from nursing homes and another large percentage of elderly and infirm? And aren't these people, aren't these the least likely to travel to Vermont to come on vacation?
Yeah, I'll ask Commissioner Pichak if he has a breakdown of what that number is in Massachusetts. Clearly, when you look at deaths, everything you said would be true. That would be where the deaths would be most prevalent. I'm not sure about active cases right now, but remember that even in facilities, most of the time it's not from a visitor because they have pretty restrictive visitation. It's not from the residents who live there because they didn't go anywhere. It's innocently brought in from the staff who happen to live in communities that surround that nursing home. So it still gives you a very good idea of what is going on in communities in Massachusetts. And I would think that that would be the important point to really understand well. We're using it as a way to assess how much virus can be transmitted in a certain area of the region, and then extrapolating that to what would happen if people from that region were allowed to visit Vermont.
And
the governor has a word to say about that first.
Yeah, I just want to remind everyone, speaking with Governor Baker about how this started in Boston, for instance. This was they had a conference, biotech conference. There were 200 people at this conference. They had two presenters who came in from Europe for this 3 to 4 day conference. By the end, it was maybe 5-6 days later, all of a sudden they saw an outbreak, and it all led back to this conference. By the end, 175 out of 200 people at this biotech conference became positive. So these weren't the elderly. These were younger professionals that were at this biotech conference. So again, I don't think we can determine anything in terms of who is most affected. Certainly, those who are elderly, compromised, have chronic conditions, are more susceptible to the ills of the virus. But we're all able to transmit and get the virus. So let's keep that in mind.
Sure, but I mean, what was the death rate amongst the people at the convention that got the virus?
I have no idea, Steve. I have no idea. But does that matter in some respects? I mean, because they went home to their community, their family members, their parents, their grandparents, and then what happened? So
yeah,
if we don't prevent people from spreading it, then others do get it, and then we do have a huge death rate. Look at the the United States. We're over 100,000 people right now who have died from this virus. Nothing to be proud of.
No, but then again, in an average flu season, we lose 60,000. So yeah. This is, I mean,
well, we're not done yet.
I don't want to seem
Steve,
heartless.
We're not done.
Sure. And Governor, when I had asked your counsel or your spokesman had got back to me about the legal justifications for the state of emergency, they gave me Title 20 and specifically chapters or whatever, Section 9 and whatever. But anyways, under Title 20, subsection 13, number 3, the termination. According to Vermont law, it says that receiving notice that a majority of the legislative body of a municipality affected by a natural disaster no longer desires the state of emergency continue shall declare the emergency terminated within that municipality. Upon termination, the functions set forth in Section 9 shall cease and local authorities shall resume control. So according to law, Governor, couldn't a municipality, any municipality, declare your emergency order terminated?
Yeah, Steve, one thing I'm not is a lawyer, Steve, so I'll let you debate that with other constitutional lawyers and so forth. But at this point in time, I think we're on solid ground.
Okay, great. Thank you very much.
Guy Page.
Hello, Governor.
Good morning.
Good morning. As a former editor of two Winooski newspapers, 30 years apart, I recognize Winooski has a large generational low-income community. I don't think really it's making anyone the enemy to talk strategically about compliance. I was in two convenience stores in Barrie yesterday, only 2 of 25 customers wearing a mask. Do your numbers, and this is maybe a question for the commissioner as well, do your numbers reflect a COVID-19 compliance problem in low-income communities? And if so, what's being done about it?
Commissioner Pichek, do you understand the question enough to? I'm not sure that I do. So, Commissioner Pichek.
So thank you for the question. I mean, about compliance, we've talked about this week over week how Vermonters have been compliant with the various orders. We look at the mobility data. We certainly had a dramatic decrease in mobility and had the lowest mobility in northern New England for weeks upon weeks during the stay home, stay safe order. So we also, obviously, part of the numbers that we're seeing have to be the fact that Vermonters are not just, decreasing their mobility, but staying physically distant and following masking recommendations. So we've seen great compliance on those metrics in the past. I can't speak to mask compliance specifically, but we'll continue to look at our numbers, and that will tell the story for us over time.
So you can't really break it down according to, for example, income levels or urban, rural, anything like that?
No, I mean, we certainly put the cases out by county, and I think you can see that, where that falls in the state and where the active cases are, not just in the state but in the region, but not on the granularity of income or other sort of qualitative measures.
Okay, thank you.
Maria, the Washington Post. *6 to unmute, Maria.
Hello. Yes. Thank you. Can you hear me?
We can.
Oh, great. Thank you. Thank you, Governor, and everyone for holding this press conference. Governor, I wanted to ask you, what do you think are the most important factors owing to Vermont's low numbers so far?
I think it's we took a lot of steps early, and we didn't waste a lot of time. And Vermonters accepted that, and they also complied with all the measures. So I think that resulted in us having very low rates and to put us in the position we're in today. The unfortunate part, obviously, is that we're based on a region within, for us, within a 5-hour drive, we have millions of people who we rely on to visit our state. So that's been frustrating in some respects. Because we have to watch what they're doing, because what they do affects us.
So, Governor, just to quickly follow that up, just realistically speaking, given the recent outbreak you had, I mean, is this really sustainable for Vermont? I mean, are you just being straightforward with folks? Can Vermonters expect this just to spread everywhere and continue to see outbreaks, or do you think the numbers will remain this way?
Yeah, no, I don't think it's sustainable in some respect. Well, I don't know if we can continue to take all the steps we've taken. That wouldn't be sustainable. In terms of, we're just watching and trying to mitigate this as best we can and open up different sectors and making sure there isn't a ripple effect as a result. So we're going to continue to do that. We're seeing some good news in other states, so that's going to be very helpful for us in our economy as we open it up more and more. So, until there's a vaccine, I'm not sure that any of us are going to be in a situation where we won't expect another outbreak at some point, or this will continue. That's why, we've enhanced our tracing and testing capacity, and that will be continuing for the foreseeable future and enhanced in many ways.
Thank you, Governor.
Colin, 7 days.
Hi, this is actually Courtney. I'm filling in for Colin. Can you hear me, Governor?
We can.
Okay. So I have a question from someone on Twitter, and I have to give a hat tip to Jane Lindholm for doing her live tweets during this press conference. But the reader listener is wondering if there's any guidance or timeline for immediate family, such as grandparents, grandchildren that live near each other but not in the same home. Is there essentially, can a grandmother or grandparent visit or hold their grandchild yet, or is the guidance still to maintain the 6-foot social distancing and only see each other outdoors? Maybe Dr. Levine can speak to this.
Yeah, I'll let Dr. Levine answer.
Thank you for the question. I want to be very specific. I'm speaking in national terms, not Vermont terms, because I don't think there's anyone in the country that doesn't want to have a grandparent see a grandchild or their own child and doesn't want to see some easing of restrictions. But the guidance still on a national basis is that people need to, in a way, assess their own risk. So clearly it's easy to assess your risk if you have some chronic illnesses or you have an immunocompromising condition. If your only immunocompromising condition is age, which is regarded that way, unfortunately, even the Centers for Disease Control is still pretty much saying that you should be respectful of that and try to reduce the opportunities that you will be able to contract the virus by breaking with some of these protocols like physical distancing. Having said that, I think we have to be human beings and understand each other. And again, we conveyed the term trusted household at one of our previous press conferences when we began to talk about social gatherings again. So again, families know each other well and I think can really assess levels of risk, if you will, and begin to start thinking about opening up, if you will. Now, we're talking about grandparents that are community living and not in a long-term care facility at this time. As the governor pointed out, we're at least talking 3-4 times a week in the last couple of weeks about how we can, in a very deliberate manner, in an informed manner, relax visitation rules at some of our nursing homes and other long-term care facilities. And there is a very important approach to doing that, which we're trying to outline now and set up so that this can become a reality in the summer when the weather is as nice as it is currently, so that at least on an outdoors basis, families can somewhat reunite. But that is not established just today. There's been some very recent federal guidance coming out about that. There are some interesting and new opportunities for us to do more targeted testing in these facilities as well. So that will be part of a very cohesive package of initiatives. But expect to hear from us on that as the month of June goes on, for sure.
Okay, thank you. And just one last question maybe for the governor, another listener question. When will local governments, do you think, be allowed to reopen public meetings for general attendance?
Well, again, I think our gatherings at this point will go from 10 to 25, so that would be the limit, social distance, trying to keep separated. I would encourage people to wear masks and leave it up to the local legislative bodies to determine their own rules at that point.
Great. Thanks so much.
All right, those are all the questions. Just one note from your legal counsel on the earlier question, Governor, from the governor's legal counsel. This is a statewide declaration of emergency, so municipalities do not have independent jurisdiction, and there is a specific provision saying that municipalities may not issue orders in conflict with the governor's statewide order. So.
Yeah. Thank you. So with that, we'll see everyone on Monday. Thank you very much.